everyone. We're going to talk about Chapter 8, Nursing Informatics Roles and Competencies. Okay, so the objective for this chapter, we want to provide an overview of nursing informatics, historical development on it, explore the concept of nurses as knowledge workers, and discuss the evolving roles and competencies of nursing informatics praxis. So, kind of just delving deeper into how nurses fit in informatics and how it became its own discipline, nursing informatics. And for those of you who are searching, like, oh, I might want to get my master's in something and change my role. I don't think I want to be a provider. I don't think I want to be an educator. This is a really cool area. It's blowing up, and there's so much opportunity for growth. And, I mean, it's quite lucrative. So, anyway, I have a friend who does this. She consults and travels all around the country, and she's very specific. She does informatics for hospice, and it's just quite interesting, just where her role as a nurse has taken her. So the world has witnessed an unprecedented number of technological advances during the last 100 years, right? The 1940s was the dawn of the computer, and it just kept getting cooler and cooler. In the early 20th century witnessed the invention of the car and the airplane. Modes of transportation drastically changed how people work and play. They were able to get access to things that they never had. The entertainment world was dramatically altered by the invention of radio and television, and now knowledge was passed quite quickly. And so the introduction of the computer altered the way data and information was viewed and utilized, and it changed the way business was conducted. And the computer is changing nursing and healthcare, and it changes the role of the nurse in healthcare as well, and opens up new doors for us. So what's nursing informatics? Okay, the term informatics derived from the French term informatique, which means to refer to the computer milieu, meaning the computer environment. So Health and Information Management Systems Society defined informatics as the discipline concerned with the study of information, the manipulation of information via computer-based tools. So nursing, how we disseminate nursing information, manipulate that through computer-based tools. So healthcare began to use computers in the 1950s. Computers to this area were typically used in the business office to track financial aspects of healthcare. But in the 1970s, nursing began to realize the importance of computers to the nursing profession and became involved in the design, purchase, and implementation of information systems. Even at its most basic programming, nursing informatics kind of started to peek its head out. In the 1980s, medical nursing informatics specialties emerged. Even as simple as coding, we started using the computer for that. And as personal computers were introduced, it allowed for flexibility in how clinical systems were used. And also remember, as personal computers were introduced and the dissemination of knowledge increased, so did the patient knowledge and technology. And that changed the way healthcare had to be distributed and had to be reached. It also brought to everyone's attention that not just nurse informatics specialists are needed, but all healthcare personnel would need to know about these systems because it's pretty obvious that we were going to be using it. So the first certification exam for nursing informatics was taken in 1995, and post-2000 era saw an unprecedented explosion in the number and sophistication of both computer hardware and software. And that's kind of where that master's came into play. Electronic patient records became an integral part of clinical information. And again, this was at its most raw and basic form. Telemedicine became possible and was recognized as a specialty in the late 1990s. And it started a lot with monitoring of patients far away, especially in those critical access areas. So you had this remote access to patients and their needs via electronics. So being able to be an attending in the ICU from the comfort of their home 100 miles away with really great nurses staffing the ICU. And telemedicine just kind of exploded from there, and just different ways to improve healthcare through technology, and it's not just taking care of patients, but also how to track patients. So telemedicine also exploded. And nursing informatics has experienced rapid growth in the last 40 years. It doesn't appear to be slowing. It'll be interesting to see what's going to happen over the next 40. So the goal of nursing informatics. In 2008, the ANA updated the scope and standard of nursing informatics practice. And the ANA lists the goal of nursing informatics as the goal of nursing informatics is to improve the health of populations, communities, families, and individuals by optimizing information management and communication. So what does that mean to us? We were sitting there just now talking about data, information, knowledge, and wisdom. And so how do we look at this from a nursing standpoint? Again, we are here to optimize health and patients' abilities and look at communities, families, and individuals. So what we're doing with nursing and how we can integrate it into information management and communication. And so when you look at it from that angle, and I hope you understand this, is that we can use information now to make people better and using that nursing approach. So you want to talk to people about losing weight? Nurses are great at doing that, right? Because we use the holistic approach. Man, now we can open up more doors with nursing informatics than we ever had before. We can do nurse classes online. We can have a personal nurse who texts you every day. And you can reach thousands of people with fewer staff, which is helpful in a sense as the need increases, but we don't have the workforce to support the infrastructure. So the goal of nursing informatics truly was to just expand the nursing arm beyond the reach of the office or the hospital. Then it has been established that nurses use data and information. This information is then converted to knowledge. The nurse acts upon this knowledge by initiating a plan of care, updating an existing one, or maintaining the status quo. Knowledge can be defined as the distillation of information that has been collected, classified, organized, integrated, abstracted, and value added. A worker is one that works especially at manual or industrial labor or with a particular material. The term knowledge worker was first coined by Peter Drucker in his 1959 book, Landmarks of Tomorrow. And knowledge work is defined as non-repetitive, non-routine work that entails a significant amount of cognitive activity. So we're thinkers. That's what we are. Nurses are thinkers. We are constantly taking in data and information and converting it into knowledge, and sometimes using it in our wisdom to help people. And so a knowledge worker is one who has advanced formal education and is able to apply theoretical and analytical knowledge. And we use all that to better the nursing field and to better the nursing care that we give to our patients. So knowledge needs and competencies of nurses. The amount of information available is vast and expanding exponentially, which makes the healthcare industry the most knowledge-intense environment. Computers, technology, and the informatics field are assisting healthcare workers in dealing with this information explosion. Okay, so think about this. Think about how there's just so much more out there. And we are growing so quickly with what we can do. We have to keep up with technology. And also, people are coming in now saying, I saw a commercial for Pneumovax. I want my pneumonia vaccine. We have to be able to support that. People saying, I want to get a stress test. I'm having chest pain. We have to be able to support that. People are getting more knowledge faster, so we need to bring healthcare to them faster. And also, we need to harness all this information coming at us because there's so much false knowledge out there. And that's kind of the flip side, the dark side of this increased knowledge base that we have with technology.